First off tonight, as America remembers and celebrates members of the military who made the ultimate sacrifice, living veterans have struggled with another enemy, the coronavirus pandemic. Joining us now to talk about how veterans have fared over the past year are Dr. Jeffrey Oken, Acting Chief of Staff at Edward Hines Jr. VA Hospital in Maywood, and Dr. Sarah Unterman, ER Doctor at Jesse Brown VA Medical Center in Chicago. Doctors, thank you both for joining us very much. Dr. Oken, let's start by talking about mental health, because so many civilians and non-veterans have suffered through the pandemic. Reports of loneliness, depression, and so forth. And a new study on military veterans concluded that, quote, psychiatric symptoms and suicidal ideation are prevalent in veterans who have survived COVID-19. So during the pandemic, did you see more patients struggling with mental health?
We did. So the great thing about the pandemic and about mental health services are we can provide these virtually. So all of our veterans were able to get the care and the access to the care that they needed. So if they were having problems, they reached out. We could reach out to them either by VA Video Connect or by telephone to meet their needs. We continue to do that. Some are coming back and having face-to-face visits, but there are options for our veterans to get that care when they need it and in the amount that they need it.
But as I understand it, most of your connecting with veterans had to do Zoom or on telephone. Is that just as effective as meeting with veterans in person?
So, you know, it is. One of the things that we do encourage is a video visit where we can actually see the veteran. Many of their visits are short visits just done by telephone, but if they need a more extensive visit, we encourage them to be seen and to have that connection eye to eye.
Dr. Unterman, you're in the emergency room. What are you seeing in terms of people presenting with mental health concerns?
So we're seeing, we were very concerned actually about an increased risk of mental illness and substance use amongst patients, especially those who weren't engaging in care. But our virtual modalities, like Dr. Oken was discussing, have really helped with connecting our patients in ways that we hadn't been focusing on nearly as much prior to the pandemic. So we have been able to reach our patients in the places that they need and at the times when they need, which has really helped considerably. We did have a patient who came in just a few weeks ago who was an opioid user, and he came with significant signs of withdrawal. And one of the things that we had focused on during the pandemic was increasing the availability of buprenorphine or Suboxone availability at our facilities. And we were able to start this patient immediately on buprenorphine, set him up with primary care, have him come back the next day for changing his dose based on his symptoms. And we were really able to hook him up into the appropriate modalities that he needed to help him. And so we've learned a lot.
Excuse me, what exactly is Suboxone? Is that the phrase, the name you used? What is that?
Yeah, so it's one of the medications that can be used to help people who do use narcotics, specifically opioids, to stop needing non-prescription opioids and to prevent them from having severe withdrawal symptoms.
Dr. Oken, now that the CDC has issued its suggestion, its recommendation about masks, and there's a, quote, return to normalcy to a certain extent, is there any issues that you're seeing as we segue as a society to what appears to be a new phase?
So one of the things at VA and in all medical centers, we continue to have mandatory masking on our campus. We do have concern, obviously, as the mask usage goes down. We are optimistic that that means vaccination is up. However, we're still concerned and we're still prepared if we do see a surge in COVID cases because of the change in recommendations by CDC.
Dr. I'm sorry. Excuse me for interrupting. I thought you'd wrapped it up. But Dr. Unterman, are you seeing vaccine hesitancy on the part of veterans?
We are seeing some vaccine hesitancy. What we've found is most effective is to just keep talking about it with the veterans over and over. This isn't a one-time discussion that then you leave. This is a multiple discussion where you, at every single visit and every contact with the patient, discuss with them the positive reasons to receive a vaccine, discuss any concerns that they may have. And we've seen many cases of veterans who initially were skeptical, but over time have come to the conclusion that it's the right thing for them and their families.
Dr. Oken, back to you. During the height of the pandemic, some people may have delayed medical care on other issues, not just mental health. But are you seeing any sort of pent-up demand for health care on the part of veterans?
Oh, huge pent-up demand. I mean, it's really amazing. There are procedures that were put off, other care needs that were put off. Our clinics are full. We are getting our veterans in, both face-to-face as well as virtually, getting the procedures that they need done. But yes, there is a huge pent-up demand out there. And, we are very fortunate that here at Hines, we've been able to meet that demand, both out in our community clinics as well as on our main campus in Hines, Illinois.
Dr. Unterman, both of you alluded to the use of telemedicine. Does the experience of the past year or so cause you to think that some of these changes might be permanent, a greater reliance on telemedicine?
Oh, they definitely will be. When we talk about our clinics being full, which they are, we're fully back open and ready for all business in every specialty. We are not going back to the old model of everybody must come in face-to-face for every single appointment. We are going to maintain a significant proportion of our appointments as video appointments so that there's a greater flexibility for our patients, and it really helps break down barriers, especially for those who have trouble commuting to a facility. They may live far, they may not have good transportation. This allows us to meet patients where they are, literally and figuratively, so that they can continue their care.
Dr. Oken, according to Military Times, Veteran Affairs officials reported no new COVID-19 deaths last week across the country. Are you seeing fewer COVID-19 hospitalizations?
Oh, we are. I mean, the numbers have continued to go down. Our veterans continue to get more vaccinations, which is helping that. And I think they're also very, compliant, and they've been throughout the pandemic and wearing their masks and following social distancing. So yes, we are seeing a definite drop, but it is not zero where we are hoping and anticipating it will be.
Dr. Ernstman, we've been focusing on COVID and its impact on veterans, but looking at the very big picture, what would you say right now is the most pressing health need that veterans face?
Well, it's hard to put your finger on just one. I think one big one is access to care, to ensure that they're receiving the specific type of care that they require in the time frame that they require it, and we've made huge strides in providing that care. Another is mental health and suicide prevention, which we're deeply embedded in, and that's one of our biggest focuses, and we have some of the most talented mental health professionals working for us so that we can address those concerns.
And that's where I'll have to leave it, Dr. Oken, Dr. Unterman. Thank you both for giving us an update. We very much appreciate it, and good luck with your important work.
Thank you very much.
Thank you.